two interpretation options available. An American Sign Language interpreter should appear pinned on the webinar console and will be available throughout today's presentation. A Spanish language channel with an interpreter is available in the controls along the bottom of your Zoom panel. We'll take questions at the end of today's presentation. An email form was distributed to all who pre-registered for today's event. Please add any questions into that form throughout the presentation today. This webinar will be recorded and posted online later so that you can share it with others. I'm Nikki Maloney, the Interim Director of the Business Support Division of the Office of Economic Development and International Trade. Our name is long, so we call ourselves OEDIT. OEDIT creates a positive business climate that encourages dynamic economic development and sustainable job growth. We advance the state's economy through financial and technical assistance programs, from grants and loans to our Small Business Navigator hotline, and to information sessions like this one today. 2 years ago, Colorado had its first case of COVID-19. OEDIT and Governor Jared Polis partnered with the legislature to pass 12 bills that appropriated $228 million in funding to support economic recovery efforts. 2 weeks ago, Governor Polis announced Colorado's next chapter, our roadmap for moving forward. State agencies will maintain a level of preparedness and agility in order to keep Coloradans safe and healthy, whether it's for the next wave of this pandemic or an unknown pandemic in the future. Today, along with my colleagues from the Colorado Department of Labor and Employment and the Colorado Department of Public Health and Environment, we will cover a business success story, what you need to know about the Healthy Families and Workplaces Act and the Public Health Emergency Leave, and resources that you can share with your employees. Colorado businesses want to keep their employees and customers safe and healthy. We're happy to share a success story with you today. ARC Thrift Stores has 31 stores in Colorado with more than 1,600 employees. It's one of Colorado's largest employers of people with Down syndrome, autism, cerebral palsy, and many other intellectual and developmental disabilities. 96% of ARC Thrift Stores employees are vaccinated against COVID-19. Very few employees left when ARC Thrift Stores implemented their mandatory vaccination and testing policy. Here to share that story is ARC Thrift Stores Vice President of HR, IT, and Vehicles for Charity, Louise Vaughn. Louise, welcome.
Thank you.
You've served in a management role for 18 years at ARC Thrift Stores. I have to imagine the last 2 years were amongst the most challenging. Can you tell us how things unfolded for you?
In ARC Thrift Stores, it was very scary for everyone, just like it was for all the community. And what we really tried hard to do is communicate with everyone about the company direction, about jobs, about how COVID-19 and all the uncertainties with it was going to impact the company initially, as well as later on, short-term and long-term. So to do that, we actually went to the stores and the various departments. We met with employees at their work location, and we talked about the situation. We answered their concerns, their fears to the best of our ability, because early on, very few people really knew what was going on. We were early on identified, ARC Thrift Stores was identified as an essential business, and we implemented all of the safety protocols. So that meant we could reopen. And that was in the May 1st timeframe of 2020. All the safety protocols for masks and sanitizing, social distancing, gloves in our stores and departments, greeting our customers, providing masks for our customers, all those kinds of things. And we actually went out when we reopened and had our management staff and our corporate staff and all of our support staff in the stores to greet our customers and to help our employees feel safe and feel like the safety protocols were there to protect them, as well as the customers, as well as our ambassadors. By the way, our ambassadors are employees who have disabilities, and we have about 350 of them. So that was really part of our goal, was to provide a safe environment. We communicated that we wanted our employees, if they got sick, to stay home. if they had family members that got COVID, that they should self-quarantine too. And we paid them to do that. So if someone was homesick with COVID, they just got paid their regular schedule. We wanted them to be healthy and then come back to work symptom-free. So we followed that. Employees knew that we wanted them to take care of their health so they could still have a paycheck to pay their rent and buy the groceries. And I think this made a big difference to all of our employees. And as the pandemic kept going and there was a lot of uncertainties, our employees knew that we really wanted them to get vaccines. We partnered with other organizations. We hosted vaccine clinics at our work locations. We gave them paid time off to get vaccinated. If they had symptoms or side effects from the vaccine, they got paid time off to stay home so they could get better. We provided information about vaccines, locations to get them if they didn't attend our vaccine clinics. And we encouraged everyone to get a vaccine and to really protect themselves and their families. In many cases, we arranged transportation, even having some of our store managers in our ARC thrift stores drive employees to get their vaccines and driving them back or driving them home. So that was our focus.
Fantastic. What a wonderful example. There are no government mandates for the vaccination. You've created your own policies, correct?
Yes, we adopted the OSHA mandate when it came out and made it a policy for ARC thrift stores. And again, with the safety of our employees and our ambassadors in mind, we do daily tracking of vaccination rates. We monitor testing. We report on cases. And when we had outbreaks, and luckily we don't have any right now, we would work with the various health departments and follow their guidelines for outbreaks in the stores. So we are at 95% vaccinated employees. And this includes our ambassadors, who I mentioned are our employees with disabilities. And anyone who's not vaccinated, they can come back to work. We're following the OSHA mandate, but they need to do weekly testing and wear masks. And for our vaccinated employees, masks are optional in our stores and our departments. So we are from a testing and quarantine standpoint, we always followed the CDC guidelines and kind of made that the point at which we would determine what do we do next? How do we handle the next thing? A lot of uncertainty there.
Definitely. I'm sure every business owner on this call can relate to that. I love hearing how your leadership team really supported all of your staff. Can you go into more detail about how you communicated to employees to kind of keep this momentum going?
Sure. One of the things that our employees love is our president CEO, Lloyd Lewis. He visits stores weekly. With 31 stores, not every store every week, but he has a schedule. And that way he can talk about, and during this time, talk about the vaccine, how important it was to protect themselves, their families, their customers. And that also allowed employees to ask him questions right then and there, to have, the president standing in front of you. If you have a question, he'll answer it to the best of his ability. We also published lists of locations for vaccines, boosters, and testings, and would email those out to the stores as they changed, as they often did. And then we help people sign up. We have some people that had difficulties signing up because maybe they didn't have a laptop at home or they didn't have access to the internet, those kinds of things. And so we would help them sign up to get vaccinated through our stores and through our store managers or the corporate office.
Fantastic. Fantastic. ARC Thrift Stores has done so much to keep employees and customers safe and healthy. What are you most proud of?
We look back and actually try to determine if we should have done anything differently. And as a management team in this time of uncertainty, and now looking back 2 years later and things, went as well as could be expected, I don't think we would have done anything differently. Our focus was always on safety for our employees, our ambassadors, our families, our customers, and every decision that we made, whether it was from reopening and sanitizing, or to allowing people to come back to work with weekly testing and with masks and those types of things. All those decisions were all made to protect people and to keep as many people as possible out of the, from getting the virus.
Thank you so much, Louise. We really appreciate you joining us today.
Thank you for allowing us. It was great to be here.
Thanks. The Healthy Families and Workplaces Act is a law that requires all employers to give all Colorado workers paid sick leave. To help us better understand this law, I'm pleased to welcome Eric Yohe, Outreach Program Manager with the Division of Labor, Standards and Statistics at the Colorado Department of Labor and Employment. Hi, Eric.
Hi, Nikki. Thanks for having me today.
Sure. How much emergency paid sick leave do workers in Colorado get during a public health emergency like COVID-19?
So Colorado employers are required to provide up to 2 weeks of paid sick leave for their employees to take for COVID-related reasons. So that's 80 hours for full-time employees. The amount is prorated for part-time employees based on a typical 2-week schedule. Public health emergency leave is a supplement to accrued leave that employers are also required to provide under what's called the Healthy Families and Workplaces Act.
Thank you so much. Let me lay out a couple of scenarios. Can workers take paid sick leave if they have a vaccination appointment or if they're trying to take a family member to get vaccinated?
Absolutely. Employees are allowed to use public health emergency leave for vaccination appointments and to be able to take their family members to get vaccinated as well.
And then what if an employee has vaccine side effects after getting vaccinated? Can they take sick leave for that? And
absolutely. Receiving side effects, experiencing side effects is a qualification to be able to take paid sick leave, public health emergency paid sick leave. Just like any other type of condition that would prevent you from working that is related to COVID.
And that is the case also if they're taking care of a family member?
Yes, ma'am.
Thanks so much. What if an employer won't let a worker take paid sick leave? What should the employee do?
So our biggest focus is compliance, and we do things like these to make sure employers understand the law. But if an employee believes that they are owed paid sick leave under the law, they can file a complaint with my division, which is the Division of Labor Standards and Statistics. That website's coloradolaborlaw.gov. But the bottom line is we don't want to investigate complaints any more than employers want to be investigated. We want to help businesses be compliant with the law. If you aren't sure if you're following the law or if you have specific questions on how to provide paid sick leave under the Healthy Families and Workplaces Act, reach out to us. Our compliance investigators are available to help you walk through the requirements of the law and answer any questions that you have.
Thank you so much. That's great to hear that you're interested in collaborating with business owners.
Absolutely.
Thanks so much for joining us today, Eric.
Thank you, Nikki.
Yeah. A reminder to our audience, we'll take questions at the end of the presentation. You do still have time to enter those into the form that was distributed via email. Next up, to talk about the many resources for vaccines and testing in Colorado, we have Scott Bookman, Director of the Division of Disease Control and Public Health Response, and Incident Commander for the COVID-19 response at the Colorado Department of Health and Environment. Good morning, Scott.
Good morning, Nikki. Good morning, everyone. Thanks for joining us today.
Scott, can you tell us more about Colorado's approach to COVID-19?
Well, to start with, it's been a long 2 years, to say the least. Obviously, COVID has changed how we live, how we work, and we have mounted an all-of-state response over the last 2 years to find the right balance in protecting our health and our safety, along with keeping our economy open, keeping our schools open for in-person learning. Colorado has had a very successful response. We've got the 10th lowest death rate in the nation. We have more than 81% of Coloradans received at least their first dose of vaccine. And we are continuing our efforts to ensure that those vaccination numbers go up, as we know that that is the most important tool in the future here.
So what happens next?
Well, we find ourselves at an interesting spot, both in Colorado and in the entire country, which is in a place of cautious optimism, which is something we haven't really been able to feel for the last 2 years. All of our modeling at both the national level and at the state level indicates that upwards of 90% of Coloradans at this point have immunity to COVID, which really puts us in a place to start moving forward. And so, we did roll out the roadmap recently with the governor, where we talked about that, if you are a Coloradan who's up to date on your vaccine, everybody in your household is up to date, and you don't have any medical conditions, then you can go forward and live your life. For those who are not up to date on their vaccine or maybe immunocompromised, we need people to talk to their doctor, make a plan for testing, make a plan for the therapeutics that are out there. And then, for those who aren't vaccinated, there's no better day than today to go ahead and get your first dose. So, with that as the general framing, we look forward to the future. And so we have this kind of 4-pillared roadmap where we focus. The first pillar is on hospital preparedness, ensuring that we have a reliable and robust amount of hospital surge capacity to ensure that we can always take care of COVID patients or anyone else. Also about engaging our healthcare partners to ensure that there's broad and easy access to vaccines and to therapeutics, really normalizing the care of COVID in our community. The second pillar is our ongoing public health response. And my top message to the public is that we will always be here, hopefully a lot more behind the scenes than we have been, and monitoring the situation. Doing our wastewater surveillance, doing our whole genome sequencing, doing sentinel surveillance to ensure that we know exactly what this virus is doing and where it is headed, so that we have the ability to tell the public what they need to know. And we will have the ability to scale our work back up again if needed, to do a booster campaign, to provide community testing. So your public health departments, both at the state and local level, will continue to work behind the scenes. The third pillar is on our healthcare workforce. True frontline heroes over the last 2 years, have been taking care of all Coloradans with COVID or with anything else. It's been a long 2 years, and we've seen a lot of people leave the healthcare workforce. And so we need to invest time, resources, strategies, partnering with our institution of higher education, our healthcare institutions to really rebuild that healthcare workforce. Then finally, the fourth pillar is we can't do this alone. We are going to need to partner with the federal government on some of these reform efforts, around insurance levers, looking at some of the issues around price gouging that we saw with some of these staff, agency nursing contracts where we were paying hundreds and hundreds of dollars an hour for nurses. You can't charge $10 a gallon for gasoline after a hurricane. And so we're going to need some national reform in that area as well. So that's where we head from here. And we at the health department will be working behind the scenes for the foreseeable future to keep everybody safe and healthy.
Thanks so much. It's fascinating to hear all of the level of involvement that you've had throughout all of this. How can employers and employees help going forward?
Well, vaccination is still our #1 tool to keeping people from having severe disease and from preventing hospitalizations and deaths. So really anything that we can do with our employers to ensure that employees are given the resources that they need, the time that they need, the information that they need to go ahead and either get their first dose or get up to date on their vaccine. I think that is probably the most important thing that we would ask of our partners in the business community today.
Fantastic. Thank you, Scott. And thank you to your fantastic team as well. We appreciate all you've done. We will move now to our questions. We have a few that have come in. First up, we have one from a business owner. If an employee starts part-time and then increases to full-time, but has 90 days until benefits start, do we have to start sick time sooner? And I'm assuming Eric,
yeah. I can answer that question. Absolutely. So when it comes to the Healthy Families and Workplaces Act, the accrued paid sick leave requirement and the public health emergency leave requirement, and we are still in a public health emergency, start on the first day of work. You can have other separate benefits, other types of leave that you can require a 90-day period for, but you cannot require a 90-day period for the required accrued and public health emergency leave under the Healthy Families and Workplaces Act.
And just an add-on question to that relates, if an employee is part-time with no benefits, do they have to be allowed to now accrue sick leave, paid time off, or public health time off?
Short answer is yes. Just the same answer as the first question around the 90 days. There are no exceptions for part-time employees. All employees accrue accrued leave at 1 hour for every 30 hours of work, and all employees are entitled to that public health emergency supplement up to 2 weeks for COVID-related reasons.
Great. Okay, I have a couple of questions that are going to be directed at Scott. Eric had just mentioned that we are still in a public health emergency, but how will businesses know when that ends?
So there is still a national public health emergency declaration in effect, and then obviously the state emergency declaration continues. When we reach a point where we really are confident in our ability to move forward in a different place, then we will obviously make public announcements about the end of that public health emergency.
Okay, terrific. And then a follow-on question, what was the percentage of people that you had mentioned that either have natural immunity or are vaccinated in the state of Colorado?
So our modelers, again, both the state, the Colorado School of Public Health, and then at the national modeling indicates 90% or greater of Coloradans have some type of immunity coming out of the Omicron wave.
Okay. This is going to be another one for you, Scott. Can we ask for a positive test if someone is claiming COVID leave?
That one might not be for me.
Yeah. Oh, sorry. I'm going to toss that one, Eric. That one sounds like his wheelhouse, not mine.
Yeah, I think it is. So I want to make sure I understand the question. The question is, can you require proof in order to take leave? And I will admit this is probably the most controversial piece of the Healthy Families and Workplaces Act, but the law is clear. Employers cannot require employees to provide documentation, including a positive test, to take public health emergency leave. They can require documentation for that regular accrued leave if they're out 4 more days, but the law is clear. It has not been changed. I've heard that rumor. It has not been changed. The law has been in effect, it will be in effect 2 years in July, and it's the same. You cannot require any sort of documentation, including a test for an employee to take that leave.
Okay, and then there's a second part of this question, which this one I think goes back to Scott. How do we know that it's safe for the employee to come back if they were positive?
Well, at this point, the general guideline is symptom-free and more than 5 days, 5 days or more from their positive test. So 5 days, and they have to be symptom-free.
Okay. And then once the public health emergency is deemed as over, does that paid sick leave just go away?
I can answer that. Employees are entitled under the law to take COVID-related leave up until 4 weeks after the public health emergency ends.
Okay. Here's another one. Can you make the employee use all accrued sick time before you use the 80 hours of public health time?
No, and again, it's not always 80 hours of the public health emergency supplement. It's a supplement to the already accrued leave. But we do have in rule that employees must be permitted to use their public health emergency leave before they use their accrued sick leave. And the reason behind that is because the public health emergency will eventually end. and employees will lose any public health emergency supplement that they hadn't already used.
Okay. Move my cursor here to get up to this one. Okay. We have been guided that if you are under 15 employees, you're not required to the 2-week paid COVID sick leave relief. Only the sick pay, as you work 30 hours, you receive 1 hour of sick leave, which averages to 1 8-hour day for every quarter.
Unfortunately, that is not correct guidance. You can find out more about that on our website, coloradolaborlaw.gov. All employers, regardless of size, have been required to meet the up to 80 hours requirement for COVID-related leave. It was only the accrued leave that was delayed until January 1st, 2022, but all employers have been required to provide public health emergency leave since January 1st, 2021.
Okay. Businesses need a reliable site to access all federal, county, and state public health emergency declarations and notices of the end of such emergencies. Is there one?
I can tell you that all of the state orders are on our COVID website. I don't believe they link to the federal orders, and they certainly don't bring all the local orders in place. So that the local orders would be, on the county websites.
Okay.
And I can speak a little bit more to the relevant federal order, which is from the Department of Health and Human Services. It's a pretty easy shortcut to Google Health and Human Services Public Health Emergency Declaration. I'll go right to the most current public health emergency.
Thank you, Eric. Are the 80 hours allowed for public health emergency per year?
Yeah, and I see several questions that are kind of in this vein, so I think I can answer a few of them in one answer. It's up to 80 hours for full-time employees for the duration of the public health emergency. So if someone needs to use leave to get vaccinated and takes an hour or two, and then later they do get sick and have to take a week off, all of that will count towards that 80 hours. It's not just, there's been a misconception that once you take any sort of public health emergency leave, even if it isn't the full 80 hours, that you're done. And there also has been this misconception that that requirement renews every year, and that is not true either. It's for the duration of the public health emergency. And to be honest, when this law was passed, I don't think anyone expected that this type of leave would still be required to be provided in March of 2022, but it is what it is, and that is what the law requires.
And I think we're going to just be able to take one last question, and this goes back to if an employee has tested positive for COVID-19, can you require a proof of a negative test to come back?
So that's funny. That's a really good question, because this is not mentioned in law, but it's been my division's position that an employer can require proof of a negative test to come back to work.
Okay. Well, just as a reminder, this session has been recorded and will be posted online. We want to thank you today for joining us for this quick overview of resources for Colorado businesses. If you have additional questions that we weren't able to answer today, this slide offers each of our agencies' websites and links to hotline numbers. Our small business navigator hotline can direct you to resources and answer questions about specific funding and technical assistance programs that are available. Our hours are Monday through Friday, 8 a.m. to 5 p.m. Thank you all for joining us today.